After a literal lifetime in the spotlight, obviously, Selena Gomez's face/body/appearance has changed. It's called getting older, and she'd really like it if everyone could stop making a federal case out of it, please. After a TikToker posted a side-by-side comparison of Gomez's face as a teenager and an adult.
I dealt with a lot of body shaming this year, and I've never experienced that before.
Girl.
I'm proud of that. Man, it's not even about my weight. It's just that I'm not going to give a what people say. Sorry. Man, that hurt. That was really hurtful.
And actually declined to speculate on her possible procedures, citing Gomez's well-known health battles. The only murders in the building star commented bluntly, "Honestly, I'd hate this. I was on stripes because of flare-up. I have Botox. That's it. Leave me alone." Other commenters are assuming that stripes is an autocorrect and was meant to be steroids, which makes sense as a treatment for a lupus flare-up. In this video, we are going to talk about Selena Gomez's new face. Before we start the video, please like and subscribe to our channel for future updates. Let's get started. Seemingly in response to the dust-up, Gomez also posted a series of selfies to Instagram, showing the natural fluctuations to her face shape that happen because she is a human being. Faces phases, she captioned the slideshow, which shows her in bed, in the car, getting ready, with and without makeup, and on a plane. Her boyfriend, producer Benny Blanco, commented on the post "Pickle Princess," which is what her shirt says in the first photo. Selena Gomez face surgery. No, Selena Gomez hasn't had plastic surgery. Commenting on plastic surgeon physician assistant Marissa Barriennuevo's recent TikTok video, which included a series of side-by-side photos of the actor from over the years, Gomez wrote, "Honestly, I hate this. I was on stripes because of flare-up," she penned, referring to being prescribed a steroid by her doctor. "I have Botox. That's it. Leave me alone." Her remark was made on a 2023 video shared by Marissa Barriennuevo, a Florida plastic surgeon assistant who makes videos educating viewers about various procedures and often speculates on what work celebrities have had. In Gomez's case, the TikToker didn't make any guesses, noting that Gomez's lupus diagnosis could be a possible reason for changes in her appearance. "I literally have no idea what she has gotten done," said Barriennuevo. "I think she's been through so much in her life, especially medically related, so I don't think it's fair to speculate whether or not she's gotten cosmetic things done. At the end of the day, let's just leave her be." Still, Barriennuevo did share a side-by-side pictures of Gomez, one from her a few years ago, and another snap at the 2023 Golden Globes. That led for many in the comments to draw their own conclusions, ones in which Gomez appeared to respond to as well. "I was on stripes because of flare-up," Gomez wrote in her comment, many assuming stripes was an autocorrect for steroids. Selena Gomez, lupus disease. American actor and singer Selena Gomez says she was initially terrified at the prospect of opening up about her mental health struggles. "I went back and forth on whether I'd do it or not," Gomez said. "And I think the moment I did that, I felt this insane amount of release because there wasn't any hiding anymore." Selena Gomez has been praised for explaining how her body changes when she takes medication to treat lupus. The singer, 30, has previously been open about her diagnosis with the condition, but she's recently been subject to nasty comments about her appearance. "I would much rather be healthy and take care of myself," she said. "My medications are important, and I believe that they're what helps me." Lupus is an incurable autoimmune disease where the body's immune system becomes hyperactive and attacks normal tissue. Symptoms can be managed using medication. In 2017, Selena revealed she had a kidney transplant linked to her lupus. Speaking on stage at the South by Southwest Festival in the U.S. city of Austin, Texas, Gomez came to realize opening up was the right move for her because of the way in which it had helped others. Gomez was on a panel exploring mindfulness over perfection and getting real about mental health, in which panel members spoke about navigating negative self-talk and making the journey towards authenticity. What is lupus? Lupus is a chronic autoimmune disease that is unpredictable and commonly misunderstood. It is a complicated illness that affects different people in different ways. For some, it can be mild. For others, it can be life-threatening. A lupus patient's immune system attacks their body's normal cells, causing pain and inflammation in any part of the body, but mostly skin and joints. Lupus overwhelmingly affects women. 9 in 10 patients are female. The majority develop the condition between the ages of 15 and 45. The cause is unknown. Scientists believe there are several things that can trigger the formation of antibodies, including genetic, hormonal, and environmental factors. Symptoms can also be triggered by stress, exposure to sunlight, infections, and some medicines. Lupus can be hard to diagnose because its signs and symptoms often mimic those of other ailments. Why does she talk like that? Selena Gomez lives with lupus, one of several health conditions she's experienced over the years. The Disney Channel alum has often been open about her health, especially about her mental struggles. I will always be working on my mental health, and I will always evolve. I'm not better or worse than anyone. I'm simply just a person living and surviving every day, Gomez told Today's Hodakov in a May 2024 interview. The conversation was a part of her makeup line, Rare Beauty's Mental Health Summit. Having to take steps to make yourself healthy takes a lot of work, she added. Gomez first went public with her health issues when she revealed that she'd been diagnosed with lupus 2 years prior in a 2015 interview with Billboard. The announcement came after she abruptly ended her 2013 tour to check herself into a rehab center to undergo treatment. I was diagnosed with lupus, and I've been through chemotherapy. That's what my break was really about. I could have had a stroke, she said. Lupus is a chronic autoimmune disease that can attack joints, skin, organs, and other parts of the body, according to the Lupus Foundation of America. There are 4 different types of the condition. Gomez has not specified which one she has. Chemotherapy can be used to treat severe forms of the disease. Symptoms of lupus include muscle and joint pain, fever, rashes, chest pain, hair loss, kidney problems, fatigue, and more. I've discovered that anxiety, panic attacks, and depression can be side effects of lupus, which can present their own challenges, Gomez, then 24, told People in 2016. In an exclusive Today interview in 2017, Gomez revealed that she'd often continued to work despite her lupus symptoms. I would get fevers, headaches, I would get fatigue, but I always just kept going, she told Today's Savannah Guthrie. I kind of ignored it, to be honest. I don't think I made the right decisions because I didn't accept it. And that's extremely selfish, and at the same time, really just unnecessary. I'm not really proud of that. If you enjoy this video, make sure to like and subscribe to our channel for future updates. See you in the next video.